people come in for different reasons, right? But I think when we do neurodevelopmental or psychological evaluations, the goal is really to understand how they learn, how they think, how they communicate, and how they interact with the world around them, right? How do they process things and how are they taking things in? So when we do these assessments, oftentimes, families are calling because something is hard, right? The system is stressed, the families are stressed, their kids are struggling, and that is stressful, right? And so what these evaluations can do, yes, we want to better understand those challenges, but we also want to understand what's going well, right? What are their strengths? And all kids have strengths. And this is something we talk about throughout the assessment process too. We all as human beings have strengths and we all have differences, right? And so the earlier and the sooner that we can understand those strengths and differences, the better we can advocate for ourselves. Parents can advocate for their kids. Teachers can understand what kids need. So through these evaluations, we're going to better understand cognitive strengths or differences. So their verbal abilities, their nonverbal reasoning skills, what type of learner are they? We're going to understand how they're doing academically. What are their strengths? Are they really good at reading but struggling in math or vice versa, right? And then we're not just looking at the cognitive and academic piece, but then also understanding the social emotional piece, right? Kids have to feel good about themselves in order to learn best, right? And so we always want to take a look at that social emotional piece. What's going well there? What are they struggling with, right? And so that we can, again, think more holistically about not just kind of what supports might they need for learning, but what kind of approaches are going to be best for them to really feel good about themselves. So the information, I think, as a whole from the testing, we learn about learning style, how they communicate kind of on a daily basis, what kind of needs they have, and what kind of supports they might need going forward.